Hi, my name is Eric Dowell, and today I'm going to be speaking about how to sell the elos Plus. First off, the elos Plus is the most versatile multi-application platform in the industry today, ranging anywhere from 11 to 14 different handpieces, depending on what country you're in. Before I actually dive deep into the system itself, it's very important to understand our technology being elos technology, which stands for electrical optical synergy, compared to light and laser. See, when we compete against light and laser, it's not that the laser or light doesn't work. It's a matter that there's too much energy, you can cause a complication. Too less energy, you're not getting a good result. So you're always trading off safety for efficacy or efficacy for safety. The beautiful thing with elos technology is that you're not having to trade off one for the other. You're able to use less optic energy, which typically is what causes complications to the patient, but being able to, with the synergy of radio frequency, put both energies down to the target to get a great result. So the great thing about elos technology, again, is that you're able to use less optic energy, but combined put more energy down to the target, because radio frequency is a pure energy source. One of the things that really founded this company was our broadband technology. We took the best two technologies out there at the time, the invention of IPL, which was invented by Shimon Eckhouse, our founder of the company, in addition to adding radio frequency, which helps out with texture and comfort. So now I'd like to discuss how to sell a multi-application system such as the elos Plus versus a single application. Understand, with our elos Plus, you're able to treat 11 different handpieces or 14 different handpieces, which can treat hair removal, skin rejuvenation, color correction, leg veins, as well as several other applications. To be able to do what this system does, you would have to go and spend probably at least a minimum on 5 separate platforms, which becomes very, very costly. The great thing is, especially if you're selling to a physician starting their practice and they don't already have a lot of lasers, they can start with the elos Plus and provide excellent hair removal, skin rejuvenation, as well as other applications. And also in those offices that actually don't have a lot of rooms or don't have several staff members to treat, again, this makes more sense than they having to go and buy 5 to 6 separate lasers that can do what this does in one platform. One of the most common objections in selling a multi-application platform is, can this multi-application platform be equal and rival single applications? And I would say over 15 years ago that was not the case, but today, yes. With technology, if you take a look at a very good example, the iPhone, you have several different applications. I can actually go and see my stock. I have email, I have a phone, as well as camera. There's several different technologies where, again, going back 20 years ago with technology, I would have to have several different apparatuses. The great thing, very similar to the elos Plus, is technology has evolved to the point where power supplies are smaller, you're able to have technology, the boards are smaller, so we can have equal power as a single application platform, but be able to provide all into one platform called the elos Plus. So one of the first handpieces I'd like to discuss is our Motif LHR, which basically is a 12 by 15 spot size, 810 diode with radio frequency that gives you 50 joules of diode and 50 joules of radio frequency. When it comes to hair removal, and again, if you take a look at other multi-application systems, one of the positive things with our system that really stands out from any other multi-application system is that it actually has a true collimated laser. Most of the other multi-application systems are using IPL, intense pulse light, or with low powered energy. The great thing with the 810 diode, which is a 12 by 15 spot size, is that it can fire at 3 hertz, treating a large man's back my size in less than 15 minutes. Again, time is money when it comes to hair removal, so you need something that's actually quick and effective. We also offer, that separates us from other companies, a Motif painless mode. And in that mode, it actually goes 10 hertz, very, very quick, to be able to provide comfort for the patient. When doing a demo, it's very important that we point out the feature that we use contact cooling with the sapphire tip. So which you're able to contact before, during, and after you fire the laser. Again, when demoing the system, you have 2 electrodes on both sides. Very important to lead with the electrodes, which helps out with the comfort. If you try to go the opposite way without the electrodes, it causes a lot more pain. Understand that pain is one of the number of reasons why people will buy our competitors in a demo. That or if you cause a complication. So for settings, I recommend, again, going no more than higher than, again, let's say 15 joules of laser and no higher than 15 joules of RF. It's going to take 4 to 6 treatments like every other competitor out there. So to try to turn the energy up at the highest settings, you're going to put yourself in an unfair advantage and you'll lose the deal. So our SR or SRA is actually one of the first steps in what we call the Trinity procedure, which addresses color correction. Our sublime is for tightening, and our sublative is for wrinkles and texture. So I usually start off with our skin rejuvenation, going after color correction, turning pigmented lesions darker, as well as a great feature to really create that, what I call that wow factor, okay, is to get those little vascular on the nasal fold and be able to pop those and get rid of them. So after demoing our SRA, I'll detach the handpiece and actually put on the sublime to finish up the second 2 procedures, which again is for skin tightening and sublative rejuvenation. We recently on the elos Plus launched our SRA and SR Plus handpieces, which basically you now have a 35 by 14 spot size that is, again, allows you to go deeper penetration to get a better result for more difficult and resistant pigmentation and vascular. The 2 different handpieces, which again are very nice when it comes to treating skin rejuvenation, is our SRA Plus, which is a 470 wavelength to 980 wavelength, which is very highly absorbed in hemoglobin and melanin, in addition to having half the pulse duration of our SR, which is roughly 13 joules in short pulse duration and 26 in long. So when it comes to our SR or SRA Plus, which I have here in my hand, again, as you touch the application, having 3 different attached at all times, you would hit the SRA Plus screen. You're able to point out exactly what skin type that you're treating. Let's say skin type 3. Your optic energy is on the left-hand side, as well as your rate of frequency is on the right-hand side. In addition to that, you have something that's called ISM and ISL, which stands for impedance safety measurement and impedance safety level. What this does is, again, it's another added safety feature that separates us from everyone else. So when you fire the system, having contact on the skin, you'll fire the system, and most clinicians, if they're using a competitor, only have their sight to be able to see, am I getting erythema, or if you're treating hair removal, are we getting good parafollicular edema? The great thing about elos technology and our ISM and ISL is that after you fire the system, you're going to get a reading on your platform, either giving you a number, either go up in energy or go down in energy. And so it's almost like a second set of eyes that helps you to determine to go up in energy, and which again, you want to get a safe, but you also want to make sure you're getting an effective treatment each time you treat a patient. So the next screen I'd like to show you is our Sublime technology, which again is using our infrared and radar frequency. So again, when you hit Sublime, you have our radar frequency energy to the right-hand side. And as you'll see, again, the great thing with this combination of treating with our sublative is that you're able to treat the deeper part of about 3 to 4 millimeters as you go up in energy with the radar frequency to get that skin tightening. The last applicator I'd like to talk to you about is our sublative rejuvenation. It's one of my favorite hand pieces, and when you talk to physicians that purchase, it actually is one of the most favorite as well. That is the last part of the Trinity Plus procedure. Sublative technology, again, is very unique, being that you're not ablating the skin. You can treat all skin types, all age types, all year round. which is unique and different from other ablative technologies that you have to pretty much put in the corner during the summer months. Again, you hit the screen. The nice thing is it shows you 3 different settings, A, B, and C, depending how aggressive you would like to treat the patient. So let's say if you treat, program B. And again, there's a nice analogy here. As you see to the screen, as you go up in energy, it actually will get deeper. The white is ablation, you have coagulation is the red, and the green is thermal damage. So again, giving an analogy, as you're going up, the deeper penetration that the energy will go. So when doing a demo, the nice thing about, again, our integrated software program is it has 3 different settings, A, B, and C. Typically in a demo, depending on who I'm demoing, I'll usually start off with B unless they really want to see an aggressive treatment, in which I will actually go to A and go to the highest settings. When you're actually demoing the system, again, from a prep standpoint, it's very important that the patient's face is dry and clean. That way, when you're firing the system, you're getting good impedance and getting clean shots every single time. I prefer not using numbing cream. Again, depending on the patient, setting the right expectation, I feel that it's very tolerable. And again, you'll save yourself a lot of headache and heartache when doing a treatment without getting the yellow pulses or red pulses. The other thing too, when doing a demo, is what I call patient selection. If you're treating a patient that is very young, let's say 21, their skin is fresh, there's no dyschromia, or they have no wrinkles or deep acne scars, their results after one treatment, there's not going to be much to look for. So it's very important by patient selection that you're going for people, especially what I would like to target is your type 4 skin or with very, very ice pick scarring, because after one treatment, they actually will see a result versus, again, that patient that's young that doesn't really have anything to really go after. The nice thing about this technology in the system, the platform itself, is that it's very integrated, very user-friendly. So starting off, as you'll see on the screen, that you have 3 different applicators attached at all times, which shows up here on the software. So if I'm going to be starting off, let's say, treating with hair removal, I would hit the motif LHR, which will actually now get me to the next screen, which actually will give me the 6 different skin types depending on what skin type I'm treating for the patient. So let's say I'm going to start off with treating a skin type 3. System goes on, and as you see to the right is our radio frequency. If you want to go up, you can hit the up button, obviously down. These are preset settings to be safe and effective to start off with, and then again, taking a look at clinical endpoints, you can go up in energy if needed. On the left is optics, so you can go to your optics to go up in energy or down. You have 50 joules of diode and 50 joules of radio frequency to use. In addition, we have a nice motif mode, which is here for painless hair removal. So, in taking you through the elos Plus, it's very important before the demo that you make sure that you actually have proper patient selection. I talked a little bit earlier on, especially with our sublative, that you want to make sure that the patient has, let's say, deep acne scars and they're not young with very, very clean skin. When you're doing a demo starting off with, let's say, hair removal, I really like to show a feature that we can truly treat all skin types safe and effective. So if I'm looking around the room and I see a person, one of the staff members that is, let's say, is a type 4 skin, I'm going to probably treat her, and again, treat her a fat part of the calf to show the speed and comfort. Then when I'm treating with skin rejuvenation, again, I'm looking at the person, maybe a skin type 3 to 2 or 1 who has a lot of dyschromia, meaning a lot of pigmentation, a lot of vascular, a lot of target to hit to really show what I call that wow factor. I also like to treat patients that have telangiectasias here. Again, you're able to get instant coagulation to be able to get rid of that. And again, the whole deal in doing a demo is creating that wow factor, getting them exciting, showing how great your system is and how easy it is to use when operating. The elos Plus is sold in over 90 different countries. I wish you guys much success, and let's make sure that we are communicating the best effective ways to your peers how to sell the elos Plus moving forward. I wish everyone much success. My name is Eric Dowell. Wish you well.